42% of students ages 12 to 18 reported that they were bullied during the school year. And for the next few minutes, we're going to discuss the efforts in the state of Washington to eliminate bullying and improve school safety. Hello and welcome to Comcast Newsmakers. I'm Candace Kelly, and I'm joined by Washington State Representative Marko Liias. Thank you so much for being with us today.
Thank you.
Now, this actually is kind of a two-pronged bullying bill. Recently, there was a part of the bill that dealt with suicide prevention, but already in place was something that kind of strengthened and toughened up the policies that were already in existence. Tell me first of all about the policy strengthening, and then let's move on to the suicide prevention.
Yeah, in 2009, because of the challenges that our kids are having in schools, the legislature took action, and I sponsored a bill that asked all of our school districts to dust off their bullying policies, get tough, put some procedures in place so that students and families knew how to access the policy, and then to designate a school official that would be responsible in every school district for administering that. And we really made a lot of progress. Over the course of 2009, 2010, we started to hear, those unfortunate stories in the news about how children across the country were still struggling, so we tackled it again this year and made some more progress.
Now, in terms of the policies were already in place, but it just didn't include, I guess, bullying in terms of homosexuality. Is that what the difference was?
We had back in 2002, we put in place a policy statewide that required school districts to tackle it for all students, LGBT students and all other kids in our classes, but we found that it just wasn't translating down to the classroom levels. That's why we asked our districts to sort of dust off the policies, take another shot at it, and really try and take action to push these policies to the classroom level so it's not just in a policy book somewhere at the headquarters.
Now, recently, in terms of the anti-bullying bill, suicide prevention came into place. That's been really big across the country, seems to be a trend. What is it exactly that schools are responsible for now?
So in health curriculum in middle and high schools, schools will have to talk about suicide prevention and mental health issues so that as our children continue to be victimized in schools, they at least hopefully will have some tools to cope with some of the stress of bullying at schools and learn some of the common sense strategies that they should be aware of for themselves and for their friends, to be aware for the warning signs for depression, the warning signs for suicide, and how to get help if they need it. So trying to give our kids the tools they need to take care of themselves.
Yeah, and for people who are watching now, I'm sure that maybe they don't know about some of the tools that are in place. Do you have anything that you could share with the audience right now in terms of what can be done in order to prevent suicide?
Yeah, there's sort of three steps. The first thing is learning the warning signs for depression. We know that depression is sort of a precursor to suicide, and so we teach children about some of those warning signs. Things as simple as someone giving their possessions away or talking about a sense of depression.
Sure.
And then other signs to look out for. Parents can notice, lack of appetite and other things. And then the second step is to ask your student or your friend or whoever you're afraid is sort of at risk of this, to ask them if they've thought about suicide or if they're contemplating suicide. We find that often people feel like they're totally isolated and no one cares about them, and if a friend reaches out and says, "I'm worried about you," that's an important first step. And then the third step is how to access those resources. So nationally, there's the 1-800-4U-TREVOR hotline you can call. It's a crisis line. Of course, we can reach out to counselors in the schools or reach out to a minister or a pastor in your community. There's a lot of places you can reach out once you know someone is in trouble. But it's about the warning signs, asking that question, and then connecting folks to resources when they need help.
And has anybody reached out to you and said, you know what, thank you for what you have done. The policies that are in place have helped me, or they've helped my son or my daughter?
The reality is they're so new that we haven't heard those success stories yet. But we've heard from parents that lost their children to suicide who've said, "Thank you for doing this. If this had been in place, they believe their child would have still been with us." And so when you talk to parents who've gone through that long, dark road of losing a child, and they say, "This is going to make a difference," it really fills your heart with warmth. We're making a difference for our kids.
Yeah, absolutely. And I know that you'll have some reports next time we see you, because it seems like this is a really good program to have in place for people who are in need of much needed help.
Absolutely.
Thank you so much for being with us today.
Thank you.
And thank you for joining us on this edition of Comcast Newsmakers. I'm Candace Kelly.